Hello, I'm Professor Bill Kling, and I'm a professor here at University of Illinois at Chicago School of Public Health in the Health Policy and Administration Division. I'm very pleased you took the time to check out our website and to learn more about health policy and administration. Very proud to be a member of the faculty here. I've been a member of the faculty for approximately 5 years and work very closely with students on all levels, and very much interested in you learning more about us here at UIC. My background is that I'm an attorney by vocation. I spent over 20 years practicing law, mostly in the public sector, working with school districts and colleges and universities and municipalities. Several years ago, I was introduced to public health through working on obesity prevention in school systems, and it was a really great opportunity and certainly changed my life. I've become very passionate about public health and really working with community on solving health disparity issues and working with community on engagement, on working on awareness building of these very serious and important public health issues. And I'm very passionate about these issues, particularly as they relate to enhancing community and empowering individuals and working together to find solutions. So again, I'm very pleased you took the time to visit us. So health policy and administration is a division of the School of Public Health, and of course policy is our middle name. Most of my work here at the School of Public Health is around policy and teaching policy to students both in the master's program and our DrPH program. In the master's program for MPH students, I teach a course entitled Introduction to Public Health Policy, and in that course each student selects a topic and develops what I call a policy action plan, which really focuses on learning tools to impact policy change, to work with policymakers, to have them understand the seriousness of these public health issues, and to become aware of the work we do in public health. And we work on translating the research and policy into language that policymakers understand. It's an action-oriented approach. And I'm very pleased to work with students on these policy action plans. It's a tremendous asset for the student to have as a part of their portfolio moving forward. And also it's thrilling for me to see students grow over a semester as they learn to develop a real-life project. So it is certainly an exciting adventure as we work together on these policy action plans. I'm very passionate also about working with students. I spend most of my time engaged with students, helping them to both navigate through school and then really working with them closely to try and find gainful employment after they graduate with their master's degree. It's something that I take very seriously, and I love working with students to help them find work. And in addition to the policy course, I also teach a course called Organizational Leadership, and in that course students learn at a high level about leadership development. It's a higher level thinking course. Students really first reflect upon their own leadership attributes, look internally at themselves and what makes them leaders and what's going to make them future leaders. There's nothing more important in our world today than young people who will be our world's global future leaders, and individuals that are interested in pursuing a master's in public health are doing it for the right reason. So we look at each individual student and their leadership attributes and what makes them a great leader now and a greater leader in the future. We also look at organizational leaderships. How do organizations operate? Community-based organizations, non-governmental organizations. How do organizations develop strategic planning processes, budgeting processes, working internally and externally? So those are the courses that I teach on a regular basis here in Health Policy and Administration. I also serve as the faculty advisor to all students for their field practicum experience, and this is another very exciting part of my position here. I work with students on placing them in field experiences, and also working with them to develop action-oriented goals and objectives for their field placement. And it's a very important part of the learning process here. There's a lot of great opportunities here in Chicago and elsewhere, but particularly here in Chicago, to get some great experience, to get your foot in the door, to get some practical application. And that's what really I'm all about, is making sure that students get practical knowledge and practical application. So it's really, really exciting. In terms of my own work, I focus a lot on obesity prevention and food policy, particularly, a very, very great and interesting area to work in. But I really take my framework of action-oriented policy development and can really translate that into any arena within public health and public policy in general. So I am interested in many, many things and come with a lot of passion and energy to the world of public health, and certainly like to give back to students. So welcome, and feel free to contact me via email at wkling@uic.edu, and we look forward to hearing from you soon. Thanks. Bye-bye.